Hello, my name is Bonnie Lynn Sweenor, and today I am going to be talking about aging with vision loss, taking the long view on visual impairment. I am the director of the newly established Johns Hopkins Disability Health Research Center and an associate professor at the Wilmer Eye Institute at Johns Hopkins School of Medicine. Today, the objectives for this talk are to understand how vision impairment impacts health and aging outcomes, and to discuss potential interventions to mitigate those long-term health consequences of vision loss. When we talk about aging research, it's important to understand the difference between chronological age and biological age. Chronological age is easier to describe. It's simply the difference in time between an individual's birth and today, however old you are. But biological age is a little bit more complicated. The difference between two individuals' biologic age is the kind of thing that you can sometimes know it when you see it. An example here of two older men, both the exact same chronologic age, let's say they're both 90 years old at this time, but both clearly look very different. So in one image, I am showing an older man who is hunched over, looking like he's walking very slowly, using a walking stick. The other image is of a man, same age, who's running. He's actually running a marathon. Same chronologic age, different biologic ages. What we're talking about is the difference between someone's biological aging process or speed. Is someone aging quote-unquote fast or quote-unquote aging slow? And in geriatrics, when we think about this central dogma, what makes someone age fast or what makes someone age slow, we tend to bin the reasons or the underlying mechanisms in three areas. There's cellular explanations of why someone's biologic age may seem faster or at a greater pace than someone else's. And those can be differences in their metabolism, cellular senescence, or underlying inflammation. Another category for that difference can be differences in somebody's functioning. So their physical functioning, their cognitive functioning, their social functioning, and their social interaction. And then the third bin are sometimes referred to as phenotypic markers or differences in health that can either be viewed as an indicator of how fast or slow someone is aging or as an outcome to tell us that metric. And those health indicators can be things like somebody's disability status, the number of comorbidities that they have, or how frail that they are. So the question is, how does vision fit into this overall picture of how fast or slow we age? Most people have a general sense that worldwide, our global population is aging. So the number of people who are 60 years and older is increasing, so that in 2014, there was 868 million people who are 60 years and older, accounting for 12% of the global population. And that's estimated to increase to 1.3 billion in 2030 and 2 billion by 2050, which by then will comprise 21% of the global population. Vision impairment has a large impact on our overall health. The WHO, the World Health Organization report on vision that came out in 2019 found that 2.2 billion people are visually impaired or blind globally, and that accounts for 1/3 of the world's population. About half of those individuals are visually impaired due to uncorrected refractive error, indicating that the other half are due to reasons that refractive lenses cannot correct. And as an epidemiologist, I talk about how vision impairment is associated with different factors, age being paramount among them. So the prevalence of vision impairment increases with age. Among older adults, 70 years and older, we have the largest proportion of people who are visually impaired as compared to individuals in the United States who are younger than that age. So a lot of my work over my career has really focused on trying to understand what it means to age with vision loss. What kind of implications does that have on an individual's life, on their health, on their well-being? And so we've developed this conceptual framework to try and understand that, to put vision loss in more of a geriatric perspective. And so what this slide is showing is putting those pieces together. It shows how we hypothesize that vision impairment leads to downstream changes in functioning, physical, cognitive, social, and psychological functioning. and in turn, how those changes in functioning impact an individual's overall health, including indicators of health, particularly as people age, like frailty, the number of health conditions or comorbidities that they have, and the risk for mortality. But we can't ignore that there are common risk factors that drive all of these changes as we age simultaneously, and we have to account for those things in the types of analyses that we do. Those risk factors can include inflammation or smoking. Those factors can both simultaneously lead to the eye diseases that cause vision impairment in some cases. Those factors can also lead to changes in someone's functioning, their physical, cognitive, social, or psychological functioning, and also simultaneously drive changes in someone's overall picture of health, indicators such as frailty, comorbidity, and mortality. When we created this framework, we used the WHO model of disability, and we thought it was really important to acknowledge the fact that there are important personal factors and environmental factors that may change the way that this conceptual framework is operationalized within settings and within individuals. So, for example, this framework may differ by gender. This framework may also differ if you are in an environment that is more inclusive of people with vision impairment, for example. And so my work largely has focused on that pathway in this framework, which is examining the downstream aging consequences of vision impairment. And today I'm going to walk through some of the evidence describing this relationship. And I'm going to start with talking about the relationship between vision impairment and its impact on physical functioning. My interest in this area really started many, many years ago when I was a doctoral student, looking at the relationship between vision impairment and walking speeds. Walking speeds among adults 65 years and older are one of the best predictors of mortality that we have, better than any clinical test or blood work or any other way that we can assess someone's health. Nothing predicts 5-year mortality better. Although the reasons why that is aren't fully understood, I was interested in examining the relationship between vision impairment and walking speed and building on work that had already been done showing that people with vision impairment walk slower, and I think we can probably understand why that would be. But using longitudinal data to examine if people's walking speed changes at a greater rate, and I hypothesized that it would decline at a faster rate when you're visually impaired as you age than when you're not. And on the slide, that's what I'm showing. I'm showing the data. So on the y-axis, I'm showing mean walking speed shown in meters per second. In the x-axis, I'm showing the time that we followed people over the study period, which is 0 to 8 years. And this is data from the Salisbury Eye Evaluation Study. And so what we found is that people who were not visually impaired at baseline, while their walking speed declined slightly over time, so as they aged, so did people who were visually impaired. And although people who are visually impaired always walk slower from the beginning, from time point zero, all the way through year 8, walked slower than people who did not have vision impairment, they didn't sort of tank in their walking speed. They didn't change at a different rate. So my hypothesis actually wasn't shown to be true in this case. People are walking slower, but they're not declining at a greater rate over time. We're also interested in understanding how vision impairment was associated with difficulty in walking. So we looked at data from a study called the Health ABC study, and we looked at the relationship between different measures of visual functioning, visual acuity, contrast sensitivity, and stereoacuity. And we found that people with all 3 types of those impairments looked at separately were more likely or had a greater risk of developing difficulty walking a quarter mile over time, and were more likely or had a greater risk of reporting difficulty walking up steps over time. So this was actually looking at incident walking difficulty. So this did not include people that had walking difficulty at the start of our study, but looked at people who then went on to develop walking difficulty and compared people who had impairment in these different measures of vision compared to those who did not at baseline. There's also a growing area of literature showing that people with vision impairment engage in less physical activity. This is work done largely by my colleague Pradeep Ramalu at the Wilmer Institute, many eye conditions have found this relationship that people across glaucoma, age-related macular degeneration, and diabetic retinopathy are engaging in lower levels of physical activity than their peers without those eye conditions. So the question remains, across that evidence base, what is the impact of vision impairment and physical activity on health and aging? So what that data show is that people with vision loss are engaging in less physical activity, they're walking slower, and they're more likely to develop difficulty with mobility tasks. But what we know from the geriatrics perspective is that physical activity and mobility are really one of the keys to aging well. So if somebody with vision loss is already more likely to have difficulty with mobility and physical activity, what does that mean for their overall picture of health? Are they already at a disadvantage? Is that something we're just not thinking about, that longer view, the impact of vision loss on someone's well-being? So I'm now going to talk about another aspect of functioning, the relationship with vision impairment, and that's cognition. There's a lot of attention in the past 5 to 10 years on cognition in Alzheimer's disease and dementia. And a lot of that work really has focused on understanding the risk factors for cognitive decline in dementia in older adults, and understanding different diseases and how they affect the aging brain. And as we age, we know that our brain changes and our cognitive functioning declines, but for some individuals, that decline really is different. And the implications of that decline can differ across individuals. Our brain really is critical for cognitive functioning, physical functioning, and social functioning. And we talk about that as the thinking, moving, and feeling components of our brain, the outcomes of our brain. But there really hasn't been, up until recently, a lot of work focusing or trying to understand how changes in our sensory function may impact changes in our brain. But it's through our senses that we get information about our surroundings and informs our brain about how to think, to move, and to feel. But for people that have vision impairment or any other sensory impairment, we really just didn't understand or haven't understood for a long time how that may affect the way the brain ages. And what we found is that, again, using data from that Health ABC cohort of older adults, we found that there's an increased risk of cognitive impairment for older adults that are visually impaired. And that is looked at over 7 years of follow-up. So people that did not have cognitive impairment at the baseline at the first study visit were more likely or had a greater risk of developing cognitive impairment when they had visual acuity impairment, contrast sensitivity impairment, or stereo acuity impairment, 3 different types of objective measures of visual functioning as compared to their counterparts that didn't have those types. We also looked at the risk of dementia. This is data shown from another group that used the Women's Health Initiative data set. And what they found is that worse visual acuity was associated with a greater risk of developing dementia, again, over a 7-year follow-up period. And that risk increased as the degree of vision loss also increased. So anywhere from 1.74 greater risk of developing dementia to more than 5.5 times greater risk of developing dementia over that follow-up period. So together, those data really do indicate that older adults with vision loss may be at an increased risk for cognitive decline and dementia as they age. But another important key to aging well is our social interaction and our mental well-being. And it's long been understood that there is an impact on an individual's mental health for people that start to lose their vision, particularly late in life. This is data from a study cross-sectionally looking at older adults with vision impairments, and it's showing that those individuals are more likely to report depression and anxiety than individuals who are not visually impaired. But for this work, in understanding the impact of vision loss on aging, it's really important to look just beyond depression and anxiety. This is work from last year, digging a little bit deeper into that question, and is looking at social interaction, namely loneliness, and showing that older adults with vision loss, a higher proportion report being lonely, moderate and severe loneliness, as compared to the general population, indicating that people with vision loss are experiencing social implications, not just mental health implications associated with vision loss. And then going even further beyond that, my group and a group using data from the English Longitudinal Study of Aging, our group using data from the Health and Retirement Study, have looked at the question of the relationship between vision impairment and discrimination. Both studies found similar results. Older adults with vision impairment are more likely to indicate that they experience daily discrimination, and our colleagues from the English Longitudinal Study found that higher levels of depressive symptoms and loneliness were associated with those reporting the discrimination, and that individuals with vision loss and discrimination also reported experiencing lower quality of life. In our study, which was based on a population from the United States, the domains of discrimination most likely to be reported in older adults with vision loss were related to being treated with less respect, and for other individuals acting as if the person with vision loss was not smart or intelligent. So the totality of the social and psychological implications of vision loss really need to go beyond just understanding what this means for treatment outcomes and at a snapshot of the impact of someone's life. And so what we propose is that we need to better understand the social interaction implications and the mental well-being impact of aging with vision loss, because these aspects of aging with vision loss have ramifications for health downstream that right now are largely being ignored. So now we're going to move along the conceptual framework and look at health outcomes. So what we've proposed is that vision impairment impacts changes in functioning, and we've shown that largely. But we also propose that there's longer-term implications of aging with vision loss. These are indicators or markers that someone is aging at a different rate. These are outcomes that include frailty, comorbidity, and mortality. We're going to start by going through the relationship between vision loss and frailty. So my group has focused on understanding this relationship between vision loss and frailty using data from the Women's Health and Aging studies. Frailty, in this sense, is a syndrome that is clinically identifiable and is used to determine older adults who may be at greatest risk of negative health outcomes, including mortality, healthcare utilization, falls. And so using this data from this study, we found that older adults with vision loss are more likely to be frail and to become frail than those who are not. The association between vision loss and frailty also increased as the vision loss severity worsened. We found this relationship to be true when we looked cross-sectionally, so just taking us one time point, and also when we looked over time. We found that people with vision loss were more likely to become frail, putting some temporality and causality around this relationship, to become frail over time. And we did this analysis following individuals over 3 years. Another important outcome when we're examining how fast or slow someone is aging is the number of comorbidities that someone has and the relationship between vision loss and comorbidities. This is data from the National Health Interview Survey, and what this is showing is that for adults 65 years and older, individuals with vision loss have a higher prevalence of a number of chronic conditions as compared to older adults of the same age group who do not have vision loss. This includes chronic conditions such as diabetes and asthma, as well as other impairments like hearing loss. Moving on to mortality, which is the ultimate outcome, and is clearly, the risk of mortality is clearly an important marker of how fast or slow someone is aging. There's a growing amount of literature investigating the relationship between vision loss and mortality. Although people may say there's not a direct link between vision loss and death, clearly there is an association. What I'm showing on this slide is a meta-analysis across studies showing their individual estimates indicating the relationship between vision loss and the risk of mortality, and then a summary estimate combining or meta-analyzing all of those estimates down to one synthesized estimate. And that meta-analysis point is indicating that there is a greater risk across those studies, a greater risk of mortality for adults 65 years and older in individuals who are visually impaired compared to those without vision impairment. So in summary, this totality of this work on vision and aging outcomes has shown us that vision loss certainly does have implications for health as people are aging, as well as their aging trajectories as we think about some of those health outcomes as indicators of how fast or slow someone is aging. But I do want to caveat some of these findings because the majority of these data were collected in the United States, and not all of these data sets were as diverse as I would have liked. And we certainly need data across other settings and among more diverse populations, as well as with a broader inclusion of people with different types of vision loss and different ranges of vision loss to more fully understand and appreciate these relationships. But despite those limitations, these results do tell us something. And they tell us that the impact of vision loss isn't just today, isn't just tomorrow, but it's in 5, 10, and even 20 years on someone's health and well-being. And so when we take that longer view and we think about the impact on vision loss, my hope isn't for it to be a doomsday negative message. Instead, I hope it is more of a call to action for us to rethink the way that we think about our own work, our own interaction with individuals, with patients, with people in this community. Because there are clear opportunities for interventions, things that you're probably already doing in your own clinical environment, that could change this picture. And the first of those two approaches that I propose are to think about or to test if the vision and ophthalmology interventions that we are using already, if they are affecting long-term health outcomes. We are not conceiving of them in that way or thinking about them in that way currently, but they may very well have impact. The question here is, are we undervaluing the impact of eye care and vision rehabilitation? Most often when we are looking at the implications of those interventions, they tend to be just in the short term or over a few years. But there needs to be a broader look at the trajectory and the arc of someone's life. Does going to vision rehabilitation extend someone's life expectancy? To be determined. But the other approach is sort of the flip side. Is there a way to tailor the interventions that are used in the general population of older adults for individuals that have low vision or are blind? So as someone that spends about half of my career in the vision science ophthalmology space and the other half of my career in the geriatric research space, when I hear about all the exciting and important interventions that we're thinking about for older adults, I sometimes raise my hand and say, how are you going to adapt that for people with vision loss? Because many of these interventions definitely need some tailoring. That doesn't mean they won't work once they're adapted. So there's a really important opportunity, perhaps, to leverage vision rehabilitation, to tailor those aging interventions. How do we think about, for certain individuals, not just navigating from point A to point B, but for engaging in physical activity from a perspective that this is part of healthy aging? How do we leverage vision rehabilitation when we think about the value of social interaction, again, not just for today and tomorrow, the impact that has on an individual's life, but also because it's critical for our health over time. And overall, I think we need to broaden our view of vision and eye health on an individual's life, with only a few exceptions, including some individuals with operable cataract and refraction correction. The vision loss that we have stays with us. We age with it. And now I think it's time for us to figure out how we age well with it. Thank you so much for listening.